Hello, my name is Fari Ngongoni. I'm a general surgery resident at Stanford. Thank you for your interest in our work titled Current Landscape of Minimally Invasive Pancreatectomy for Neoplasms. Pancreatectomy is performed by either traditional open approach or the recently developed minimally invasive approaches, which include use of robotic or laparoscopic platforms. Adoption of these platforms has been gradual, and in this study, we aim to show the current trends in the adoption of minimally invasive pancreatectomy, as well as compare cost and clinical outcomes among the open, laparoscopic, and robotic approaches. To determine these trends and outcomes, we used the Premier Healthcare database to identify adult patients who had undergone elective open or minimally invasive pancreatectomy for neoplasms from 2013 to 2020. Patients were separated into two cohorts, those who had undergone pancreaticoduodenectomy and the rest who had undergone non-pancreaticoduodenectomies. Each cohort was further separated by surgical approach into three groups, that is, those who had undergone open, robotic, or laparoscopic techniques. Minimally invasive pancreatectomy was defined as robotic or laparoscopic approach. Conversions to open were treated as minimally invasive pancreatectomy. Descriptive statistics were used to determine the percentage of pancreaticoduodenectomy and non-pancreaticoduodenectomy cases that were performed via the open, laparoscopic, or robotic approaches annually. Patient and hospital baseline characteristics were obtained and compared. Multivariable regression analysis was performed to compare outcomes and costs among the three surgical approaches for patients who underwent pancreaticoduodenectomy and non-pancreaticoduodenectomies. Characteristics that were significantly different at baseline were adjusted for in the multivariable regression model. In total, more than 15,000 patients were identified. Over 65% had undergone a pancreaticoduodenectomy. As can be seen in the bar graphs in the figure, the open approach was the predominant approach for pancreaticoduodenectomy over the entire study period, while minimally invasive pancreaticoduodenectomy had fluctuating rates that were less than 20%. For non-pancreaticoduodenectomies, which is depicted by the bar graph on the right, adoption of minimally invasive approaches increased and became the predominant approaches from the year 2016 onwards. For both cohorts that underwent pancreaticoduodenectomy and non-pancreaticoduodenectomies, the proportion of robotic procedures steadily increased, but adoption was faster for non-pancreaticoduodenectomies. For outcomes, minimally invasive pancreatectomy was associated with 31% higher transfusions and a mean difference in perioperative cost that was $6,600 higher than that of the open approach. In Table 1, you can also see that the minimally invasive approaches had longer operative times than the open approach by 41 minutes for laparoscopic approach and 107 minutes for the robotic approach. Robotic PD was associated with lower risk of conversion to open than the laparoscopic approach and had a lower risk of prolonged stay, which means a hospital stay of greater than 14 days. The other complications were similar among the three pancreaticoduodenectomy approaches. For non-pancreaticoduodenectomy resections, minimally invasive approaches had improved outcomes than the open approach. These outcomes included a 34% lower risk of prolonged stay, which means a hospital stay greater than 10 days, and a 38% lower risk of blood transfusions, and a lower risk of ICU admission. As can be seen in Table 1, conversion to open and splenectomy were less likely to occur with the robotic approach than the laparoscopic approach. Perioperative costs were higher for patients in the robotic non-pancreaticoduodenectomy groups than the laparoscopic or open non-pancreaticoduodenectomy groups. Mortality and readmissions were similar among the three non-pancreaticoduodenectomy groups. In conclusion, minimally invasive pancreatectomy for non-pancreaticoduodenectomies is the most dominant approach, unlike pancreaticoduodenectomies, where the open approach is dominant. We think that this is likely due to the improved outcomes, lower costs, and lower technical complexity of non-pancreaticoduodenectomy resections compared to pancreaticoduodenectomy. The stagnation of adoption of minimally invasive pancreaticoduodenectomy is likely due to the higher technical complexity of the minimally invasive approaches, with outcomes that are similar to the open approach. Thank you for your attention, and please email me with questions.